In terms of some background, for 29 years, the Summit has identified changing healthcare marketing, communications, certainly the digital physician relations opportunities, and lots of challenges that you all face every day. We've addressed them head-on with the agenda, and the tradition of doing that has never been more timely than this year, right? As you look at that agenda and topics that all of you are facing every day in the market, you're seeing a whole lot of topics related to engagement strategies, right? AI, we're excited to talk about that one. Communication strategies, the data piece that is with us for a lifetime now, strategic marketing, physician relations, and many more. And again, one of those topics that I think is on everybody's radar today, and we've really focused on in this year's agenda with so many strong sessions, is the topic of AI. Today, we're fortunate to have Merge sponsor a fireside chat with two speakers who are going to steer you towards better understanding of the power of AI, Kaveh Safavi and Chris Boyer. So Merge is an agency that brings together both storytelling and technology to solve the most pressing challenges of healthcare. Merge's experience is in technology, creating the emotional side of that, and it really sets it all in motion. Their secret is their team and a culture that makes all the magic possible. So here to introduce our opening session is Merge's Executive Vice President of Client Service and Health and Wellness Practice Leader, Kelly Bliss. Help me welcome Kelly.
Thanks, Chris. I hope everyone's having a lovely day and enjoying a few new dance moves and getting your steps in as we walk across Caesars. But with this great pleasure, we're here. Merge has been a longtime sponsor of HMPS, and we're proud to be back to introduce these wonderful guys for you this afternoon. As you all know, many healthcare organizations today are increasingly focusing on the potential and the future of AI. Right, everything from revolutionizing the way we diagnose, treat, and manage disease to streamlining administrative tasks, enabling more personalized communications and experiences, and there's no doubt that AI is transforming healthcare and will in the future. But how will it impact the workforce? How will it help us deliver better clinical care? And how will it change the work of marketing and communications? I am so pleased to be able to introduce and examine these topics with our two speakers, Kaveh Safavi and Chris Boyer. Kaveh is the Senior Managing Director of Accenture's Global Health Business and a licensed physician, which I learned today. As such, he is responsible for developing and driving a growth strategy that differentiates Accenture offerings for providers, health plans, and public and private healthcare systems across the globe. He's considered one of the nation's top experts in AI, leadership, trends, and workforce issues, and is often quoted in some of our favorite publications like the Wall Street Journal, the New York Times, Harvard Business Review, and The Economist. Kaveh will be chatting today with Chris Boyer. Chris is known to many in this audience as a results-driven digital strategist with a focus on enhancing patient experience through innovative digital solutions. As you know, as a consultant, Chris focuses on driving transformational strategies with health systems, health services, and digital health companies. Leading those with such clients or such health systems as Beth Israel, Lahey, M Health Fairview, Northwell, and Inova. He's a nationally recognized thought leader, speaker, and author, and not to be forgotten, his important co-host schedule with his Touchpoint podcast, a weekly show that I'm sure everyone can find on their favorite podcast networks. It is my pleasure to introduce Kaveh and Chris to you all this afternoon. Have a wonderful evening.
Thanks. Thank you. Thank you for that introduction, Kaveh. Excited to sit down with you. I'll be the spark to your flame of this fireside conversation today. So, generative AI, generative AI in general, we could say that, it's very prominent. It's top of mind to many people. In fact, before I came on stage with you today, I went to ChatGPT, and I said, what are some adjectives that describe the impact of AI in healthcare? Okay. And it came back with a list I actually asked it to come down to 5. The words revolutionary, transformative, disruptive, innovative, and efficient were the top 5 that it said. Yet at the same time, Fierce Healthcare recently did a survey. They actually did a bracket in honor of March Madness of the most overhyped and overused terms in healthcare, and generative AI won by a large margin, 75%. So I think this speaks to the fact that generative AI is at one point really promising, but also at the same point, I think many people are maybe misunderstand that. So let's start with that. Let's start with that topic. Tell us a little bit about your perspective of generative AI.
Well, you know, I used to work for John Chambers at Cisco, and he used to say that the problem with innovation is it attracts too much love and too much hate. And I think that's a perfect example of the challenge we have, which is, on the one hand, I think the misunderstanding of it has created an excessive amount of optimism on the one hand and an excessive amount of pessimism. By the way, Chris, I found out, somebody told me there are 70 sessions here with the word AI in it.
Yeah, that's about right.
Which is good, because now we're in compliance with federal statute. 3 or more people in a hotel room must talk about AI. It just seems to be what everyone, I think that's a really interesting point. I will tell you that AI has been around for at least 40 years. Generative AI has really been in the public consciousness less than 2 years. And while on its surface it might not seem obvious, I think there is a case for its profound nature and its impact on society as being something that we couldn't have done prior to generative AI. And I'll make the argument for that, but then we can get into the details of it. But the argument is actually one of the things generative AI can do. It can do many things, but one of the things it can do is it can take over humans' abilities to read and write, not reason. Why is that important? Because in the next 20 years, if you just look at workforce economics, the number of people that age into retirement will be 50% larger globally than it is today, and the number of people working to support people under the age of 18 or over the age of 65 will be 25% smaller. So we have an absolute existential problem of people in the workforce. If you look at all jobs and you look at tasks within jobs across all industries, about 40% of what people do are language activities that generative AI, large language models, can address. It's one of the only paths we have to extending human capacity in terms of dealing with the mismatch of working people relative to the amount of people that won't be working but need services. And in healthcare, probably more than any other industry, that mismatch is really quite profound. So without it, there wasn't a simple path out of that conundrum without a technology like this. I don't know that, you know, when it was being conceived of, we didn't fully understand its implications, but its implications over time are going to be pretty significant.
And it's evolving so fast as we see it. You know, it was 18 months ago, right, when ChatGPT kind of came into the forefront, and suddenly everybody is talking generative AI. What it was then is completely different than what it is today. Yet, from your perspective, has it evolved that significantly, that profoundly? Are we still, or is Moore's law in effect here?
Well, you know, I think, let me just step back a little bit and give you my way of thinking about generative AI, because then we can walk into the experience of ChatGPT as a consumer versus large language models versus generative AI, just to put this together. So I did mention the fact that, you know, we've had AI for probably over 40 years. And largely, it was a set of technologies that allowed us to do a level of statistical and evaluation of data to allow us to see insights that were not essentially achievable by the human brain using the tools we had up to that point. It was really, that's where its real use was looking at information and finding patterns that were not obviously discoverable. And we tried to apply it to a number of different areas, and it had certain utilities, but it lacked certain utilities, because what we were actually trying to do is get it to start to do some tasks for human beings that would generally be considered non-routine. Prior to that, every form of technology we had could only do a routine task, meaning if you tell it to do something, it does it, but you have to change it. So the ability to do non-routine tasks was really what AI was able to do. But it could only do it to a limited basis, because for it to learn something, it had to be trained. For it to be trained, it had to get a reference data, we used to call that label data, to learn from. And we recognized quickly that we would reach the upper limits of a data that would be available to train AI. And the genesis of generative AI comes from the idea that if we don't have enough data to train AI, we can create data to train AI. And we can do that by looking at existing numbers and using essentially math and parametric weighting. We can guess values that sit between other values. Then we can train on all of that. That was actually the original thesis behind it. And then the question is, well, what can we use this for? And we can use it for language, and we can use it for visual things, and we can use it for audio, and we can use it for code, and we can use it for a number of things. And those all wandered off into their own. But one of the real use cases that came forward is language and large language models, which was specifically what we get to experience when we play around with ChatGPT. The key there, though, was what we were originally developing was the ability to understand language, which is different than the corpus of knowledge that is contained inside of something like a language model. So how do I describe that? Think about taking a child and teaching them to read. In the beginning, when you teach them to read, you're asking them, you're looking at the reading, but you're not asking them necessarily about the content of what they're reading, because you're trying to see if they can learn how to read. And then as we become students, we read, but the purpose of reading is to acquire and remember the knowledge. So what's happened with generative AI is a tool that was a rich language model specifically. That tool was actually developed first to interrogate information, to basically allow people to interact with information. OpenAI specifically was designed so that it would remember what it read, and so if you wanted to interact with OpenAI and you interacted with it, while what was really happening, you were having a language experience, it was actually returning an answer to you. But the answer it was returning was based on what it remembered when it read something.
Right.
That is not the only way it can be used. In fact, what most companies are doing now is they're actually using it not to ask it what it remembers, but to ask it to read something specific that they consider authoritative and give an answer from that. So why we get confused is when we played around with ChatGPT, and I fell victim to this in the beginning. I said, oh, ChatGPT, it's so interesting, and it's flawed because it makes stuff up. And I would ask it to write my biography, and it came up with this hilariously funny biography that put me in schools that I never went to, and I thought that proved a point, until I realized that proved no point, because there's no reason why it should know my biography, because that knowledge doesn't exist on the internet. That's not the point. The point is it knows how to write a declarative biography. Now, the thing about generative AI is it is so good at language, and just like anybody who's telling you something, there has to be content embedded of it. If it doesn't exist, it will make it up. But that doesn't prove that the technology doesn't work. That proves that we don't understand that we should never use the technology to interact with information unless we either are okay with what it's going to give us or some other purpose. So, for example, it's one thing to ask generative AI to write your wife a birthday poem. It's another thing to ask generative AI if you can disinherit your wife at your will. One of them is a factually specific thing, and I tell people never ask GPT a question that you will rely on the answer in a sensitive way unless you know the answer before you ask the question. Because how do you know what it's going to? It's just going to tell you stuff.
Right.
So I think we need to understand generative AI as a language capability that has the ability to read and write, and it interacts with information, but is different than the information.
Right.
That's the key.
Right. And that example that you gave about the poem, and that takes an immense amount of computing power for it to do that as well, right? I mean, this is one of the things they're talking about is in order to make this really become what we all hope it to be, or we misperceive it to be, it will require immense computing power. Is that right?
Yes, I think that's what you're seeing now is a divergence of generative AI and large language models into two different concepts. One concept is what OpenAI describes as a generalized intelligence agent. And what that really says is that the purpose of the technology is to read and remember everything, and it itself is the corpus of knowledge. So you can ask it questions and it will have answers. That takes an unbelievable amount of computing power. Here's a great example just to illustrate it. If you took a query today and you put it into Google as a search, you would get a set of items. If you converted that to a prompt into ChatGPT, you would get a declarative statement. It would be based on the same information that the search was based on, but it would be a declarative statement. That act is 10 times more computing intense than the Google search is. That's 3.5. If you go to 4, you're almost 10 times more, about 7 to 10 times more computing power. Because it is churning a lot to try to get you to that information, as opposed to the basic concepts of search. So, most companies who are looking at it are saying, that's interesting, but what I really need it for is language fluency. So, when I put it into my contact center to help my agents find information, actually I need a very easily configured language model. It doesn't take a lot of computing power. And for a few moments in time, it is simply reading documents I am telling it to read. I'm not asking it what it remembered. I'm telling it to read the document and return it to me in language that's consumable. That takes far less computing power. So the market is starting to separate into people who want essentially a technology to read and write, and to people who actually want the technology to have embedded intelligence. Those are really going to be two different paths for how this is going to play itself out.
And in healthcare, we're seeing a significant rise of some of these real-world applications of AI that are more on the former side of the house, right? To solve tasks. Talk a little bit about what you've seen.
Well, and so because we have we have an access problem that's profound because of the lack of workforce in healthcare, and you all know about this. And the problem is unsolvable because there's not enough human beings alive to go into the workforce. We have to figure out how to extend the capacity of our human caregivers. And one of the ways to do that is to recognize that depending on what role you have, anywhere between 25 and 50% of what you do can be classified as a reading or writing task. Not a judgment task, not a reasoning task, but the act of putting information in or getting information out in preparation for reasoning. And so the ability to take those tasks over, right now, most of it we're seeing is doctor-centric. So it starts with things like summarize a 2,000-page chart for me before I go in to see a patient, because frankly, I would never read a 2,000-page chart. So at least I get a running start at that. Or what's happening on the documentation side is listen to a doctor-patient conversation over 20 minutes and then not transcribe but recharacterize it as a SOAP note the way a doctor would. So that's different than transcription because it has to know that what was said in minute 19 is related to what was said in minute 2 when it recharacterizes the note, and provide that as a note that the doctor can authenticate and give them some time back. Those are some of the big examples that are happening, but there are many, many other sorts of things that are happening right now. There's outside of the clinical workforce. If you look across all of society and ask the question, where is generative AI mostly being used now? All jobs, all industries. Rewriting code, it's fantastic at taking old code and making it new code. Because it knows, it has specificity as to its objective. It just needs to understand the languages. And that used to be very labor intensive, so all the technology, the legacy technology that we talk about in code words, we call it technology debt, and the cost of modernizing it to work in a cloud environment is much cheaper now. That's one. Second one that's being used extensively is contact center. And there are a few places it shows up in contact center. Post-call documentation takes up as much as 20% of an agent's time. Just like the doctor note, if it listens to the call, it can drop the summary in and have it authenticated, and that gives that agent time back. The second thing is finding information. What agents have to do after they listen to a question is go find information. That's usually hard to find without a lot of experience. It can help that agent find and therefore answer questions, and we see 35% improvement in many cases in terms of productivity and efficacy, because it gives that frontline agent more information. It's still human-to-human dialogue, but that person has more information. Another interesting one is it's actually listening to the intent of the caller while the call is going on, and it's anticipating the nature of the question or if the call is going to deviate. Like it can tell, for example, if this call is headed toward cancellation and potentially tee up the cancellation script for the agent, because that's what's going to happen. So that's call center is another one. Third one that's happening is around content creation, which I know matters to a lot of people in this room. First draft, content creation, big use case across many industries. Those are the ones that are really having, I'd say, a fair amount of traction. Then there are probably hundreds of smaller use cases out there.
Well, you know, and I've spent time reading studies and surveys on people's perceptions, and particularly patients' perceptions on the use of AI, and provider clinical perspectives on AI. And many of those questions that they ask are kind of fielded around the fact of, is AI better at diagnosing patients for care, et cetera? And obviously the reaction to that is negative, right, when you think about that. But from the way you described and characterized AI, it seems like we're asking the wrong questions about the application of this tool. Is that fair?
Yeah, that's absolutely fair. Because when you ask it to diagnose, there's the conversation, then there's the accuracy of the answer and the substance of the answer. And the truth is that, you know, what we're really judging on is not the fluency of the conversation, but the quality and the substance of the information sitting behind it. Generative AI specifically did nothing to advance that. I mean, that exists through traditional channels of evidence-based medicine and research, and it gets developed, and simply interacting with it becomes much easier with generative AI, but it's not. So the idea that you would substitute generative AI for a doctor, I'll just, you know, like my friend John Halamka always said, any doctor that can be replaced by AI should be replaced by AI. Because for all intents and purposes, it's just a language tool hitting up against a set of protocols that are limited by our knowledge. We didn't advance our corpus of knowledge just because we had a better language tool, or even, you know, being able to codify what standards of care is. So we're going to need the human brain right now. Most people who think about generative AI in healthcare are thinking about it as being able to extend the reach of the doctor, not substitute for the doctor.
Right. This concept of like an aide or a co-pilot as Microsoft.
It's giving them time back.
Yeah.
It's taking away the things that don't require them to have judgment so they can spend a higher percentage of their time in the act of judgment, which is what we want them to do. And let's put aside the fact that that changes the nature of their job, and we can talk about that. But that's theoretically the concept behind it.
So I know many people are concerned about AI as coming in as almost being, having a significant impact on the workforce. So I'd love to hear your perspective on how you see this new type of technology impacting our workforce from your perspective.
Yeah. So this is something I think about a lot. And the reason I think about it a lot, I got to my interest in generative AI because I started with the problem of the workforce. And the recognition that there's not enough bodies and we have to figure out how to introduce technology to substitute. And essentially the way I think about it is, you take someone's job today and you break it down, think about it at task level. Then you ask questions like, well, where can this task be done? Can it be done by a piece of technology, or does it need a human? If it needs a human, what kind of human? Somebody with a credential, with a high credential, a low credential, no credential? Does that person have to be physically present? Does it not have to be present? You end up deconstructing a job. If you were to look at, so I'll just give you an example of, we've done modeling around nursing care, okay? And we think that about 40% of what a nurse does today on a floor, acute care nurse, is amenable to technology taking those tasks over. That means we take the nurse's tasks and we concentrate them. So if I just introduced the technology, I just made my workforce 40% less productive. I have to take all those jobs, hoover them up, and redistribute them as new 100% jobs. The jobs that I hand out are not the jobs that the nurses used to have. For one thing, we recognize that instead of having everybody have a little bit of all skills, some people are going to have super specialized skills that come and go out of the workforce as needed. We use the term adaptive workforce. And then some people need a little bit of skills all the time. We call that fixed. These are totally different skills. These are a mixture of different skills, plus they have extra time, which they're going to probably do things that they're not doing today. Then we're going to recharacterize that as a new job. And so there's going to be that part of it. So we remodel work. So that's thing one. Thing two is that the work has to get done by humans and machines working together. And when humans and machines work together, humans actually need totally different skills when the technology is your coworker. In manufacturing, they call this a cobot. There's been a body of research coming out of human-computer interface labs for 2 decades on these kinds of things. But 2 examples.
Okay.
One of them is called intelligent interrogation, also known as, if you understand how, or learn a little bit about how GPT works, they tell you have to prompt the agent. Prompting is essentially the recognition that its reaction is to your input. And by the way, one thing about generative AI is it's non-deterministic, which means if you ask the question twice consecutively, the answers are different. Mm-hmm. The same words asked twice will give you different answers, and then if you deviate it, you're going to continuously get different answers. So that is why the human-machine pair keeps evolving. So if I took 2 human-machine pairs and started them at the exact same place and then re-examined them in a month, they're different because the humans and the machines work differently. Mm-hmm. So you have to learn that. The other thing you have to learn is what do you do when you get your time back? We call that rehumanizing time. Do you use it for yourself? Do you do more work? These are a whole set of skills that people have to have that are pretty interesting, and we don't know anything. We're just learning what that's like. So those are sort of, on the job. But a higher level question is, what does it really mean in this world for humans when machines do these things? And I was really struck by an observation I heard by a philosopher, computer scientist, who basically said, over time, AI's job is to answer questions, and the human's job is to ask questions as a meta level across all jobs. And that's what the premium is going to be on the human. Now, that's going to require experience, because a naive person doesn't ask as smart a question as an experienced person does. So it's not like this is going to replace experience. It's going to make what you do with your experience different.
Yeah, it supplements your experience and the learning of your experience. I know you and I were talking about prior. We were talking about real estate agents using, as part of their training, using these AI tools to do market analysis. And the CEO of this real estate company said, "This is not going to replace my junior people. This is a learning tool for them to become better."
Right.
Is that fair?
Yeah, there's actually ample research on this already where it's been used. There's some published work, like in contact centers, you see 35-40% productivity in the least experienced agents, but nowhere near that in the most experienced agents. So it has a differential effect because people with greater experience have some of the more knowledge retained, so they don't need to go look for it. Mm-hmm. If you actually look in hbr.org, there's a really interesting study. It's less than a year old. BCG gave their consultants, 700 of them, GPT-4, and asked them consulting questions. And it independently validated the quality of the work and the volume of the work, doing traditional consulting tasks. And they found as much as a 40% improvement in the productivity of the least experienced people, but they also found that it was unevenly distributed, that some people used it as a way to offload tasks, and then some people used it as a way to bolster their own quality of their work as opposed to offloading it. And if used incorrectly, 19% worse results. So this is not a neutral to positive thing. If you rely on it and don't understand how to rely on it, it will make things worse. It will give you the wrong answer.
Yeah. I heard someone say that the challenge with ChatGPT or generative AI, I think they're referring to ChatGPT, is that it's only going to get dumber because humans are using it. Right?
Yes.
But that human-machine dyad now, that's kind of what we're painting, this is going to be pervasive across our industry significantly.
I think that's reality.
Yeah, and that's something that we kind of have to prepare for. But one of the things that I'd like to kind of, whenever we talk about it in healthcare, we also have to think about this. This is a very highly regulated environment. So what are some of the challenges that we're going to face around this?
Yeah, well, it's a big issue, and yes, healthcare is regulated, but as you all know, there's a big discussion federally and nationally about AI, and it's all anchored largely in the rubric of what most people would use the term responsible AI, so a concept that's been around, it was around before generative AI. It's raised its importance in generative AI. It's primarily raised its importance in generative AI because before generative AI, it was mostly a quantitative tool, and so we worried about things like data bias and transparency of the models, and that was interesting, but not to a large swath of people. But generative AI is going to be used by lots of people, and it introduces a few things we never worried about before. Language toxicity. It's a new, if we're using it for language, this thing has the ability to say crazy things. And we have to figure out what we're going to do with it. And so that's a new area of responsible AI. The second one is, just like anyone who reads a document, it remembers things. Well, copyrights, intellectual property, how are you going to handle that? If you're going to use it, can you use it in a way that it doesn't remember things? And the answer is, if you do it the right way, yes. And that comes with limitations. And that's not. And what people want, though, is for it to learn from things, to get smarter, because it would be like, this is again overly simplistic, but to illustrate it, if I took a high school graduate, a medical school graduate, and an oncologist, and I gave them a new cancer research paper, and they read it, they would see different things. My answer can't be, I don't want anyone other than a high school graduate to read it. But for that to happen, they have to remember it. But that means that we're starting to think about things like intellectual privacy and other kinds of confidential information. Those things have really pushed us out. So I think we're seeing private sector worry about it, and particularly around the issues of privacy and around intellectual property. They're really worried about it. Yeah. Public sector is really worried around concepts of privacy. And the U.S. is, like it always is probably sitting back and watching. Will probably take the lead from Europe, because the European Commission has actually put forward the first robust statute, just like GDPR. Sort of everybody globally starts to mimic that. I think people are looking at the European model. But I think it's something that I tell every business right now, you need to have a posture and a perspective on responsible AI before you drop any generative AI in your organization. Because you're going to make a choice that you won't understand day one, unless you've decided your perspective on this.
Another area of regulatory concern, I think, is the application of AI in mental health care. I'd love to hear your perspective on how that's kind of rolling out, because we hear there's a lot of articles about what they're trying to accomplish, because mental health is a crisis in the U.S.
Yeah, so I think that conversation is best had to separate out digital tools from AI specifically. So we understand there is a material role for digital tools in healthcare, in mental health care, for a couple of reasons. One of them is purely the lack of providers, and therefore if everyone had to go to a provider to get care, then a bunch of people would be underserved. But even in the presence of providers, it's well recognized this is one of the areas of care that has severe stigma attached to it, and a meaningful percentage of people with mental health illnesses will not access the formal caregiving system because of stigma. So technology actually is a way to take stigma off the table, for which no other answer exists if we tried to use a human solution. So there's clearly an imperative to address our mental health crisis that does include technology. Now, when we start asking the question about artificial intelligence and then specifically generative AI, what's compelling about it is its language capabilities. The question is whether or not, and we know, for example, we can administer cognitive behavioral therapy on a technology platform. That's not really AI, that's just a rules-based thing. But the language interaction is the interesting part of it. And we sort of walk a fine line between what is essentially the language and what has been theoretically placed out there as an interesting thought question for you. And it's based on the fact that if you just look at the broad swath of therapy by non-doctorate level people, it is extremely heterogeneous. What it takes to be a therapist is pretty open-ended. You have schools of thought that range from religious to specific, scientific theories. If I could, in theory, just hoover up millions of conversations between therapists and patients, and basically generative AI does nothing but learn word patterns, could I replicate a therapy experience? Because really, it's just replicating a conversation it heard once before. It's a really provocative thought experiment. Not realistic, not in terms of data available, but it raises an interesting one. But what's happening right now is actually super interesting, which is GPT 3.5 because of the fact that it's engaging with people who are asking it questions. It starts telling people answers. You have a question about something about, you ask something about, your life. If you say, life is not worth living, it might say, not everybody's meant to live. It might give you an answer like that, right? I'm not kidding you.
Yeah.
I'm not kidding you. Yeah. So they are actually red teaming. They are training the GPTs to refuse to answer questions with trigger words in it. Because they don't know how it's going to be used. So it is getting neutered or muted compared to what it was like before because we're so worried about toxicity. And there are companies that go buy, for example, an OpenAI GPT asset and then try to build a clinical feature that has a behavioral health aspect and realize it literally will not talk to you if you use trigger words.
Wow.
Not that it can't, but it's been told, do not answer that, because I have no idea what kind of answer is going to come out of the box. And so I think there's a lot of interesting complexity here we're going to learn over time. Power is there, but it is not a straight line.
Well, and it speaks a little bit to the fact that the makers of these tools, right, Microsoft, OpenAI, and Google Gemini, they're already implementing their own guardrails. They're kind of self-regulating.
Yes.
And that's sort of a trend that we're starting to see is around self-regulation and even coalitions of people coming together to help regulate. Share a little bit about your perspective on that.
I think it's the right thing to do because my fear right now, and for example, within the healthcare provider community specifically, early on, over a year ago, a number of particularly academic organizations, but ones that were leading and playing around with generative AI, voluntarily said that we are all agreeing that one thing we're not going to do is use it for patient care. No patient advice. Because everybody was saying, wouldn't this be awesome for patient advice? And the answer, if you understood it, was no, it's a horrible idea. And it will, for sure, give somebody the wrong information that will, for sure, result in regulatory backlash. And we have so much we can gain from the technology if we have time to play with it, that the last thing we need is for one of us to go out and set a fire somewhere to create a regulatory backlash. So I think largely a lot of organizations are recognizing whether it's pure self-interest, their IP, or self-interest, which is I don't need a regulation to show up after a bad outcome and shut down what I see as half a decade or a decade upside. Self-regulation has to happen. Plus, in general, regulations lag markets. There are very few examples of where regulations led markets. One of them actually was using genetic information to avoid insurance or health insurance or life insurance stigma. That was done actually before the genetic information existed. But almost every other case, regulations lag. And this will be one of those where I think it's the posture is, I'm scared, but I know one thing, society needs this. So what's the way to strike the right balance is part of why the regulators are taking a cautious look at it.
Right. Well, so then talk to me about, I've seen a number of these self-regulated entities coming around. And in healthcare, there's like CHI, and there's others that are kind of surfacing. And many of the health systems out here, they are part of these associations now. How do you see those kind of helping to advance the adoption of these tools? Yeah,
that's the intermediate between an individual organization deciding for itself and a group of like organizations. I think that's a more comfortable place for most people, especially, you wouldn't want to go on this journey and try to figure out what you're going to want to do, so you follow the leaders in your industry. And I think, that's the most logical place to see this evolve to, so not surprising. I think they will ultimately be the recommending bodies that will find its way into either state or federal law.
Yeah, absolutely. I think that's an interesting thing to be part of, and those organizations here in the audience, people representing them, to be part of that will really show where some of these use cases could advance to. I'm still wondering though about how you see as we start to evolve and use this technology, start to understand it a little bit better. How do you see this evolving? What looking forward, where is this headed?
I think it's going to be, realistically, it's going to be embedded in our lives in a way that's almost indiscernible. Because it's going to be sitting behind so many things. So, for example, we will all, over time, largely have voice-based interactions with technology. And let's go specifically to healthcare provider as an example. You may or may not know this. In the United States, over the last 2 decades, the introduction of electronic health records has reduced human productivity by 13%. That's okay, because it wasn't put in place to improve human productivity. It was put in place to make healthcare safer by addressing issues around judgment and decision support, et cetera. But at the time, we thought labor was free, air quotes, and we ran out of bodies, and now it matters a lot. There is a reasonable belief that within the next 3 years, you will be able to interact with an electronic health record without having to go through a keyboard. The reason we forced people to go through a keyboard was to create structured data, because that was the only path. Someone had to put structured data on the machine. Typing was the mechanism. We will be able to interact. That doesn't mean the electronic medical record is different. It means the user experience is different. So we will see in our lives the user experience of everything evolve to a very natural language kind of a conversation. There's no question in my mind. So that makes it a fairly ubiquitous piece of everybody's life. But then sitting behind it, this idea of information retrieval, the ability to find information and collect it, its ability to speed up our ability to get information is amazing. But here's the one thing in healthcare that's really powerful. It has the ability to take something that's unstructured and structure it. So it has the ability to read a PDF and create a structured data concept. Why is that important? Because right now in healthcare, around 80% of the content is largely unstructured and is trapped in an unstructured form, and it takes an enormous amount of effort to make it structured, to use it for any kind of computable purpose, clinical or non-clinical. The reason the user interface will go away is not because it understands, but because it can convert a narrative into structured data 100%. And that ability to all of a sudden pull everything that's unstructured into structured form, and now I'm talking about visual, tabular, text, all kinds of things. It's quite incredible. The other big thing I think that's going to happen is, as a first draft or a jump start, we're going to see a lot of that in our daily lives. Because it's really good at giving us, especially if you don't know what you're starting with, a starting place.
So, there's a lot of talk about AI is on this hype cycle or the maturity curve. Like, we're in the early stages and there's going to go a crash, right? That's going to happen, and there's going to be backlash according to this. What's your perspective on this?
So I think part of the problem is that people misunderstand the Gartner hype cycle, which is the shorthand for hype cycle. It's a maturity curve. It's not an assessment of whether or not the technology is good or bad. It doesn't say yes or no. It says where it is in maturity. And that would be like looking at a 3-month-old baby and go, that's never going to amount to anything, right? It's a 3-month-old baby.
Yeah.
Like, what does that mean, right? Okay. What have you proven by that statement?
Right.
So the answer is, in the hype cycle, this goes to the fact that people have the sort of the belief of what could be versus where the reality of the technology is. The reality of the technology is early, but I don't think the belief is misplaced. And I think, like, if you looked at the Gartner hype cycle and you laid out years, you would see technologies that go up, they go down, and they go up. This will be one of those.
Yeah.
It's just a question of time.
Right. Oh, that's interesting. As you talk about this, it kind of makes sense. Your perspective on this makes sense. I still think there is a sort of a concern by others. And how do people in the audience, starting to see things now from your viewpoint, how would you help them to advocate for educating others about this? Because, healthcare leaders are looking to this as like, this is going to be the panacea for everything. It's going to solve our access problems. It's going to solve, all of these things.
Well, that's a super question, and it raises a general point and a specific point. The general point is that I would say that we are at a point in our professional lives where technology literacy is a requirement for all people in all jobs. Now, I say that to you, but particularly for a leader and anyone who's in a leadership role. We already kind of knew that. We've been talking about that a little bit at the executive level, but it's really happening. And, that would be because, and if you tell me, well, why would you do that? Shouldn't that be the IT organization's group? That would be like I don't know, going to your business leaders and saying, you don't have to read a financial statement. It's not your concern as to whether you understand, what it means, what profitability or cash flow or anything. Just do your job. Well, we have financial literacy concepts, right? We have technology literacy concepts that are important, and companies are starting to recognize that. Now, I've seen this play itself out in real life in healthcare organizations. They've actually come to me because the company I work for has decided, and of course, albeit we live in the world of business and tech, we have 780,000 employees, and we have a concept called technology quotient. All of the employees have to take and pass tests in currently now 13 domains of technology. Yes, that's because we're over-calibrated that way. But we've thought about this concept for a while. So we were hospital putting in virtual nursing. Leader said to me, the nurse said, how's a virtual nurse ever going to start an IV? Okay. Question is, what would make you think a virtual nurse should start an IV? Well, this person doesn't know what virtual nurse means. They don't know what virtual means, which shows you the level of literacy. And this leader came back to me and said, I need to figure out how to give a baseline level of literacy to my people because I cannot take it for granted that they understand it. And when they don't, that's going to make all this stuff very scary and hard to understand. So I think we are emerging into a place now where we need some level of technology literacy in any job. The second issue is, as it relates to the dialogue we're having today around generative AI and the sort of, what it can do and what it can't do, is I encourage all of you to spend enough time to understand it at a level where you can actually have an informed dialogue about it versus just and particularly for those of you in marketing, if you're in the area of content, you need to understand what it can do and what it can't do, when it can be used and when it can't be used. Because it's a tool that's going to be in your toolkit, and if you don't, that requires you to understand it. Well, if you understand it, you can explain it. That's the key. So the singularity is not upon us. I'm not worried about that. Not in my lifetime. Maybe in the 3-year-old baby's lifetime, or 3-month-old baby's lifetime. Yeah, but to me it sounds like we have to understand the positioning of where it is in context of the human, because the human is still the important part of this equation. Is that fair? Oh, for sure. I mean, look, I described to you as 40% of tasks can be done by our language tasks. So what about the other 60? Right. And the fact of the matter is the human part's the critical. In healthcare, it's really more like 20% of the tasks can be done. We're wildly human dependent, will be forever, still going to be the largest job creator. I'm not worried about any of those things. It's just different. That's the key. And my bigger problem right now is for the next 5 to 10 years is I need to figure out how to spread my clinical capacity out, because otherwise we're going to have a catastrophe of waiting time in some communities. And do you see that this technology can help to expand education of people to come into the healthcare industry? Would it make it more... Oh, that's an interesting question. Would it make it more accessible? Well, I think, it's a great question. So one of the things that we think about is, why do people work? And there's evolving body of literature that's over the last half a decade that basically says people work for more than pay or professional development. My own organization did research on this, and our narrative, it's not unique, but we have a slightly different take on it. We say people come to work for organizations that leave them feeling, quote, net better off. And that means beyond pay and professional development, concepts of safety, concepts of respect, concepts of purpose, etc. Okay, so take that as a general underlying statement. Healthcare actually underperforms relative to other industries in people feeling net better off. I think coming out of the pandemic, people felt really put upon, so we have a lot of those issues. There is at least part of that answer that can be addressed by some of these tools. It's not the tools, the technology wasn't the cause, and it's not the singular solution, but absent it, some of these problems are intractable. So I think that there's a real role there for making it better and a better place to work so that people are more interested in working in healthcare. Yeah, that's, as I look at this, and my own playing around seems like the right appropriate term here, of using these tools to try to figure out where the parameters are and the limits are. I do find it does provide a little bit of an ease in the work that I do, but it also helps to spark my curiosity. And I'm wondering if you see technologies like this as being, increasing accessibility of people that perhaps are
maybe adverse to using technology. We talked a little bit about it in mental health care. What are your thoughts about it, in terms of maybe activating patients in the right ways?
I think there's something to be said for that. One angle that I just, that this connects on, some of you may have read, it's probably been a year old, there was an interesting study done where generative AI produced a patient narrative, and they compared it to the doctor's version of the same narrative. And the objective scoring was that the generative AI language was more empathetic than the doctor.
Wow.
Was judged to be more empathetic than the doctor. Now, as a doctor, I can tell you, I'm not sure if that says anything about doctors or technology. I don't know which one it says more about, but I think probably may say more about the doctor. But in a way, you could say, what is the language model other than it is basically read everything? It is the most well-read spokesperson you can imagine. Its language skills are amazing. Mm-hmm. So thinking about using the technology to be more empathetic and therefore be more effective, that's a real use case.
Yeah, absolutely. Is there anything else before we open the floor up for some questions?
I would love to hear what people want to.
We would love to too. It looks like they're putting up some microphones here, so please, if people have questions, step up to the microphone. As we do this, I want to ask you, Kaveh, because you work internationally.
Yeah.
We have very much a U.S.-centric position. How do you see this playing out? You mentioned the EU is taking a more aggressive approach towards this. What other international factors could potentially impact this?
The concepts are all similar. The big issue right now is the issue around, there's a couple of issues around feasibility. Mm-hmm. The first issue around feasibility is that the computational power that's necessary for traditional large language models, either to be created or run, lives primarily in the US, the big three, which is Microsoft, Google, and Amazon. Mm-hmm. And outside the United States, in many countries, particularly Europe, there's a reticence to put citizens' data in these technologies. And it was all based on a situation that happened in Sweden where the FISA court actually got information about a Swedish national from Microsoft without telling the Swedish government it was doing that. And that created a big issue around their U.S. companies subject to U.S. laws. They can go get data. And, so there's a reticence to that. So that's thing one. The other is we spend a ton of money in the U.S. on technology, probably more than other sectors do.
Right.
And so in the absence of resources, we see slower adoption.
Yeah, that's true. All right, we have a question.
Fascinating. My name is Dave McDonald. I have a question. You remember David Ferrucci, I'm sure, at IBM when they did Watson, and he talked about probabilistic versus deterministic sort of concepts. And you called out probabilistic, sort of the nature of probabilistic, or the problem with that. And you talked about, I think you said neutering, and then the idea of mental health and behavioral health. What's your view on, is it possible that AI could have play a role in providing guidance? We talked about maybe competency a second ago.
Sure.
Concept. And for example, behavioral health, or even clinical diagnostics.
Yeah.
Probabilistic versus deterministic in those.
Yeah. Well, I think as a general rule, what the technology continues to be good for is describing, now I'm talking about AI, not generative AI, is pretty traditional AI. It's pretty good. I mean, it's going to be able to find essentially correlations and associations. The challenge is to decide whether or not those are valid. That's the scientific method is designed to go back and do discovery. A decade ago, I was watching this interesting small debate between two DARPA teams. One was called the Big Mechanism and one was called the Big Data Group. And they're fundamentally asking this question, do you need to know the mechanism to get to an answer, or can you do it through big data? And the net answer is, absent the mechanism, you don't know for sure, but big data gives you a way better running start at your experiment than without it. And I think that's what we're seeing, for example, in pharmaceutical R&D and in silico bio, right? It gets us a way better running start. But at the end of the day, the pipe still goes through experiments and other kinds of proof for certain things. Now, if you start to get into things that aren't biological in their nature, so let's say logistics, which is very different. In logistics, all you need is to see the statistical correlation and to look for patterns. You don't need to go do an experiment, because that's not the nature of how that works. In fact, the experiment will happen in real time when you adjust based on the data. So there you can see a direct expression of a technology going right into direct use without having to go through any kind of a vetting process.
Great. I think we have another question here.
I just want to say thank you for your talk. It was incredibly engaging for the end of a very long day.
My pleasure.
But I think what you were kind of speaking to was the idea of prompt engineering and understanding how to properly ask questions that are both responsible and helpful of these new technologies. And in looking, there's been a lot of courses that have popped up from Udemy to MIT to Purdue on prompt engineering and understanding how to interact with that. Do you recommend that folks, that it's better to take some of those courses and engage with kind of this new skill set in a more traditional academic way of learning those processes? Or do you find that you learn best by actually engaging and interacting with the tool?
I think so far our lived experience is that using it is more valuable than reading about it. Although if you've never done it before, there's a little bit of value to that. The other thing around the issue of prompts is that people will give you these lists of best prompts. They're irrelevant if you don't have context for the problem you're trying to solve. That's the difference. That's why I said, the job of the person is to ask questions, and a college graduate asks a different question than a high school graduate asks a different question than an oncologist. So you can't just read a playbook and then walk in and go. It would be like saying, I could be an oncologist if I just, knew what questions to ask. Well, you can't, because what are you going to do with the information? Right. So there is there's still the corpus of knowledge that makes the prompts useful that you can't get through just understanding the method of a prompt. You actually have to understand the problem you're trying to solve separate from the method of the prompt.
That's so true, right? You can't read a book to become a doctor. You have to practice.
Right, exactly.
Right, and that's like our business as well. Are there any other questions in the audience? Yeah, here we have one right here coming up.
Hi, thank you very much. Great discussion. I feel like a lot of people, my head's going to explode.
Uh-oh.
Okay, so I'm going to get down to a very basic question.
Okay.
How can AI help people get and stay healthier?
That's it. So I love that question because it presupposes that an answer exists. And I think we have to separate it into two separate problems. Like, does an answer exist? Okay? And if the answer to that exists, one might discern it through research that may or may not require AI. When an answer exists, the question as to how to deploy that is a different question. And one could argue that the right kind of technology that possesses the ability, for example, to access it without waiting for a human or to be more empathetic might actually be pretty compelling. But in the absence of the answer, the experience is meaningless. And I see a lot of people that are overrunning the ball right now because they look at the experience, and I go, what makes you think there's a useful answer on the other side of that question?
Right.
That's the issue.
Yeah, that's a good question. Here we have another question here.
Excuse me, how concerned should we be when we put in our prompts, let's say our institutions or individual names, out of fear that it may be part of the bigger, bigger part of the group? Should we be concerned, or is it?
You should be extremely concerned unless you know what you're doing. That's one of the reasons why organizations need to have very clear guidance on when and what to use. If you were to put it into GPT 3.5 public, it is public. Now, what organizations do is they create their own sandboxes with GPT 4. And then they say, look, all work has to be done in our company's sandbox. GPT is only one example. You pick any of the language models. But pick your own sandbox as an example, where the information stays. And then sometimes that information stays and it's going to stay within the organization. Sometimes people will say, and we see this too, we're seeing this outside the U.S. in particular. I know for a fact that my data, if I sent my data to your cloud, how do I know that you can't backdoor the thing? How do I know that a subpoena can't get to it? How do I know that how do I know? And so there's a lot of people that are so worried about it architecturally that they're saying, I'm not going to send anything to your data center to run because I consider it to be sensitive, and I want the technology to be run on my side of the technology infrastructure, not on yours, which raises a whole bunch of complex issues. But I think we were worried a lot right now, and I talk to healthcare systems in particular, where their CIOs are worried about GPT, and they have this whole plan around how they're going to do GPT, or how they're going to do, large language models, and how they're going to do responsible AI, and how they're going to protect their IP. And I said, what about your independent medical staff? Because they all hack. And they said, what do you mean? I said, they're going to hack tomorrow. They're going to try to build a workaround. Do they know that they just released PHI? You've got a bigger problem than just having a corporate solution if you have stakeholders that have the potential to go out and use a public technology where if they use a public technology, it is 100% been released.
So I'm looking through some of the questions people are posing on the app for us. And here's one that I think we may have kind of alluded to it, but I would love for your response to this. Someone asked, in what ways has AI shown to improve patient engagement and outcomes? And can marketers better leverage that when they're trying to advance their technology implementation?
Yeah. I touched on a couple of things. One of them is the quality of the information that is returned goes up because the generative AI allows you to find more information more easily than normally would be at your disposal. And then the empathy coach part of it, whether it's a direct interaction with the customer or it gives the language to the customer service agent or the coach or the nurse or whoever, both of those things we know currently are ways to help from an engagement perspective. That's generative AI.
Yeah.
The second side of that would be more of a discovery issue around patient propensity, which is traditional AI. And then you would sometimes use generative AI to take conversations, listen to them. So we're seeing people do this right now, right? So basically they're listening to a conversation in a call center and they're codifying it. And then they're going to take that data and do traditional analytical things to it to try to create new discoveries about patterns, behaviors, preferences. And they'll do that using traditional technologies, maybe traditional AI. And then that may or may not get redeployed in a use case through a language model. But it's really about the source of data. It creates a new source of data for discoveries as well as a new way of accessing the data.
That's interesting.
I don't know, you may have just touched on it actually, but my question is, how can AI help with transforming to value-based care? Or is there a particular thing other than, you mentioned empathy as far as communication goes, but are there other particular ways that can help with that transformation?
So to me, value-based care is a large, complex, primarily economic concept that has almost innumerable levers, some of which technology, some of which artificial intelligence, some of which large language models might be amenable to it. But at a meta level, the bigger question is I don't think technology is a simple tool. Value-based care is a complex organizational process. So there are for sure things you can do with it. You can have better insights and you can deploy them, but how you deploy them, whether you get value out of them, is a totally different conversation.
Yeah. And we're struggling enough with the concept around value-based
Absolutely.
care.
Absolutely.
So maybe there are little components of that large, complex equation.
Well, what's interesting, honestly, is that we've had a value-based care conversation for 20 years.
Yeah.
Because we thought that was mostly, that was about utilization and doctors making good choices and patients making good choices. The next 10 years, the healthcare inflation drivers in the U.S. are largely labor costs because of a shortage and specialty drugs, none of which have anything to do with doctors making good choices or patients making good choices.
Yeah.
So one could argue that large language models that are making the cost of labor, bringing the cost of labor down and creating access might actually be the value-based care model, which is not the same thing as making good choices.
Interesting. Are there any other questions? I'm looking through some of these questions, and Kaveh, I think it might be important for us to maybe kind of go back and talk a little bit about open versus closed models, because there's been a number of questions that were asked, and we just want to be clear about it. There are closed systems in which health systems can enable it, like you refer to it as your sandbox, where all those questions and all that data can be contained and not shared on the open environment. Now, those closed models can use open source large language models on top of it, where they're learning from the other open source environments, but they're keeping that data very close. Is that a fair way to describe that?
There's a concept called retrieval augmented generation. So it takes a language model, a reading and writing asset, built someplace else, and it brings a picture of it into your environment where it is reading your documents. So you're not asking it what it remembered when it was trained on the internet. You're asking it to read your document and give it an answer, and it's doing it in a closed environment.
Right.
That's the key there is to separate out the language from the knowledge. And in the environment we're describing, you're making sure that your information is never remembered by the reader effectively, which you can do.
Yeah. Okay, so one last question from the app, and a lot of the question was around some of the things we covered, but one of the one point here it says is there a way that healthcare can walk the fine line of deploying AI to improve care and patient experiences, as well as operational optimization, and not get caught in some of the negative press around the level of fear of AI? And I think it kind of speaks to how does implementing AI can impact the brand and reputation of an organization.
Yeah, there's no question right now. People are afraid of it because it's the trust issue is low. And part of it is, frankly, and I've seen this research, right? They ask a patient about, do they want their doctor to use AI? And they go, no. Well, that's stupid because they don't even, because what they thought they were answering was, do I want the diagnosis to be made by AI? Not, can the doctor save time by having the note written? They're not going to care about that. Or the fact of the matter is when you ask a question imprecisely, you get an answer that reflects the bias. So the general narrative around AI in healthcare was a surrogate for a judgment of a doctor, which is scary, and nobody trusts it. So I think part of our problem and our challenge is to be super clear around what we're doing and what we're not doing, which is why I think if we don't take a responsible AI posture ourselves organizationally early and make sure that people have literacy, they're just not going to know what they're reading. And then they're going to make all kinds of bad guesses about what's happening.
This has been a great conversation. I think very engaging from the audience, and I really appreciate you coming.
My pleasure.
Having this great conversation, Kaveh. Thank you so much.
Thank you.